Good morning, and welcome to the Johns Hopkins Health Security Exercise, CLADEX. My name is Anita Cicero. I'm Deputy Director at the Center, and I will be your host throughout the day. Welcome to all of you in the audience, and also to those listening on Facebook. Because today is going to be videoed and live streamed, we have a few requests to make of you this morning. One, please no flash photography. Two, please stay in your seat and be quiet as possible throughout the course of the day. We ask you, too, to hold your applause until I introduce the participants, and then again at the end of the day. We won't be taking questions or comments from the audience this morning, but we really do encourage you to engage on social media throughout the exercise with the hashtag CLADEX. The goal of today is really to illustrate the potential consequences of a pandemic, think about the challenges that would pose, and also to consider some policy solutions that would improve those outcomes. The scenario, obviously, is fictional, but it is well researched, and we've based it on epidemiologic modeling, public health principles, and an assessment of past outbreaks. All of the assumptions that underpin the exercise have really been carefully researched, but any could reasonably be challenged. We aren't asserting that the specific scenario that we're portraying today is the most likely to occur, but we are asserting that we're simulating an event that is possible. The model and all of the assumptions behind our scenario, as well as the backstory about CLADEX, will all be available on the CLADEX website following the exercise today, and we encourage you to look at that. But during the exercise, we ask you not to focus so much on whether you agree with certain of our assumptions or not, but rather really to look at the big picture of what is going on and think about the policy implications for health security. Health security issues are nonpartisan issues, and this exercise is explicitly nonpartisan. Although it is set in the current time, it's meant to be a generic representation of senior levels of government. The president and the administration, those gathered here, are not meant to represent this current administration or any past administration. The players who will be participating in the event have worked in different administrations and are from both political parties. Other than the National Security Advisor, none of them know how the exercise will unfold, so they'll be learning that along with you. We've asked them to base their participation really purely on their past experience and best judgment. The president in the scenario is offstage and will be interacting with the participants only through the National Security Advisor. So this is how the day will work. There will be a series of meetings that are convened, and it's an ad hoc working group that the president has asked to advise on the ongoing outbreak. Members of this committee, called the Executive Committee, or EXCOM for short, are members of the National Security Council, and then a few additional members that the president thought were necessary, including the Senate Majority Leader and the co-chair of the Congressional Biodefense Caucus. Now, you will see during the course of the day that a lot of information is conveyed to this group over video news clips. And we understand that that's not how the NSC gets its information normally, but it was a convenient way for us to convey information both to the audience as well as to the participants in an efficient manner. The policy challenges to be discussed are high-stakes, controversial issues that require NSC-level attention. So the exercise presumes that the interagency, including DOD, ASPR, CDC, and others, have been meeting up until this point. But now alarming new developments have occurred that really requires the NSC to get involved. Please join me now in welcoming our participants. John Bellinger will play Secretary of State. Jim Talent will play Secretary of Defense. Jamie Gorelick will play Attorney General. Margaret Hamburg will play Secretary of Health and Human Services. Tara O'Toole will play Secretary of Homeland Security. Jeff Smith will play Director of the Central Intelligence Agency. Tom Daschle will play Senate Majority Leader. Representative Susan Brooks will play Co-Chair of the Congressional Biodefense Caucus. Julie Gerberding will play Director of the Centers for Disease Control and Prevention. And Tom Inglesby will play the National Security Advisor. So here is the world situation as the exercise starts. It's May 15th, 2018, and this is the first XCOM meeting. The U.S. is still engaged in military operations in Syria and Afghanistan, and we are in the midterm primary election season. An outbreak of a new serious respiratory illness has been recognized in Germany over the past several weeks. And the scenario now starts with the National Security Advisor convening the first meeting of the XCOM.
Thank you all again for coming on short notice. The President needs your advice and judgment. He's called you together here because of your experience, your knowledge, and your national leadership. We've got a very serious situation. To start the meeting, I want to begin with showing you the Global News Network clip from this morning.
We are continuing our coverage of a new and deadly infectious disease that broke out in Frankfurt, Germany, and Caracas, Venezuela. 2 days ago, the World Health Organization responded by declaring a public health emergency of international concern, a highly unusual step and an indication of its deep worry. Here are the numbers. In Frankfurt and Caracas, the illness has killed an estimated 50 people. There are 400 confirmed or probable cases, with additional reports of suspected but unconfirmed cases. The illness first appeared in Frankfurt about 4 weeks ago. The patients were initially diagnosed with viral encephalitis, a kind of brain infection. Some also were suffering from pneumonia. The first death occurred within days. In Germany, there have been several clusters of cases within families and at workplaces. At least 4 of the dead were healthcare workers who had treated patients infected with the disease. Based on this, German authorities have concluded that the illness is likely spread to person, probably through inhalation of the virus. Our medical reporter Emily Schmidt is at the CDC in Atlanta with more. Emily, what can you tell us?
Jean, CDC officials tell us that most cases are occurring in healthy adults, but there are some cases in children and the elderly. 3 U.S. Air Force service members at Ramstein Air Base have been diagnosed with the disease. Multiple hospitals are involved in Germany, including the U.S. Army's Landstuhl Regional Medical Center. Patients are being placed in respiratory isolation. Many worried well are showing up at emergency departments and clinics. Public health authorities in Germany have been working to isolate the sick and track those who have been exposed. Now, this disease is characterized by fever, cough, confusion, and in many cases, coma, respiratory failure, and death. Initial tests to identify what was causing the outbreak were all negative, but scientists at the Robert Koch Institute discovered a previously unknown virus in the spinal fluid of several of the patients, a new type of para-influenza virus. Para-influenza is a common respiratory virus. It's unrelated to influenza and typically causes colds in adults and croup in kids. It does not normally cause severe illness in otherwise healthy adults.
Thanks, Emily. Venezuela is reacting very differently. Authorities there are denying there is an outbreak, despite reliable reports from people in Caracas of hospitals being swamped by hundreds of suspected encephalitis cases. There are no details or accurate numbers for us to report. However, Colombian health officials have confirmed that 3 people who fled to Bogota from Caracas for medical care do have the virus. How is the rest of the world responding? Well, Australia, China, and South Africa are restricting travel from Germany and Venezuela. Health officials around the world are screening travelers and investigating possible cases. As of now, there are no reported cases in the U.S. As you can imagine, this outbreak is major international news. Numerous media outlets are in round-the-clock coverage mode. Some are calling the outbreak a flu pandemic, and one network has dubbed it the German flu, although experts emphasize that para-influenza and influenza are unrelated, and there has never been a para-influenza pandemic. Scientists have now given this new strain a name, para-influenza CLADEX. You are going to be hearing a lot more about it in the days, weeks, and possibly months to come.
Okay, so there we are. And with that as the background, I want to invite Eric Toner, Senior Director for Global Health, Security, and Biothreats from the NSC, to brief us on what the U.S. government is doing to start.
Good morning, everybody. Here is a timeline of recent events. The first cases of the outbreak seem to have appeared in Frankfurt approximately 4 weeks ago, and in Caracas approximately 2 weeks ago. We can confirm that there are 3 U.S. service members who are ill in Germany. They are all in critical condition. They are the only U.S. citizens that we know of that are infected with this virus at this time. The map summarizes the current information. There are 316 confirmed or probable cases in Germany with 32 deaths. We have limited information from Caracas, but our best estimate is that there are more than 100 cases and 20 deaths. All these numbers are preliminary and will be adjusted as we have more additional information. They may be significant underestimates. Reports indicate that this is a very severe illness in most people and has a high fatality rate. While the first reported case was in Frankfurt, the epidemic's true origin is unknown. Since Frankfurt is a major air hub, the initial assessment is that it spread to Venezuela from Frankfurt. There are also reports of possible cases in London, Tokyo, Taipei, and Kabul. All of these are being investigated. Surveillance is poor in many countries, so we can't be sure that we're aware of all the cases or all the outbreaks. At this point, more than 10% of the diagnosed, confirmed CLADEX cases have died, but we do not know the actual case fatality rate. The virus does appear to be transmissible person to person through the air, and very preliminary assessments from Germany suggest that on average, an infected person infects 2 to 3 other people, which makes it about as contagious as flu or SARS, but much less contagious than, for example, measles. The preliminary information is that the incubation period is approximately 5 to 7 days. At this point, Dr. Amish Adalja from the CDC will brief us on the virus.
The genetic sequence of the virus has been posted online. CLADEX seems unrelated to any of the previously known human parainfluenza virus strains. Within a virus family tree, a group of related organisms is called a clade. Since we don't know how this virus relates to its other family members, it is now widely being called CLADEX. Like the initial cases of SARS and MERS virus, the origin of CLADEX is uncertain. We know that most newly discovered human viruses, what we call emerging infectious diseases, result from animal viruses that jump the species barriers from animals to people. So that would be our initial hypothesis. Germany has shared a sample of the virus with the US, and so NIH and CDC, in collaboration with top US parainfluenza scientists, are analyzing it. There are no known antiviral drugs that seem likely to be helpful for the disease, although thousands of licensed drugs are being screened. There have been human parainfluenza virus vaccines in development for years, but none are licensed. And our initial assessment is that none that are in development are likely to be effective against this strain of the virus, given its genetic distinctions. But we will be examining that. Vaccine research has been initiated by US government and pharma labs, in a number of other countries, including China, India, Brazil, and the EU. The best estimate by leading vaccine producers is that it could take a year or more to develop, test, and manufacture a vaccine for the CLADEX virus.
Thank you, Dr. Adalja. Just to reiterate, this is not influenza, but the CDC does judge this to have pandemic potential because it is a novel virus and it does seem to exhibit efficient human-to-human transmission. The CDC has developed a PCR test for the virus. Currently, it is only available at the CDC and some international laboratories. It will be pushed out to state laboratories in the coming days and weeks. Travel alerts have been issued for both Germany and Venezuela. Alerts have also been issued to hospitals and health departments. Any patient meeting the case definition should be isolated and reported to the CDC. The CDC, in collaboration with Customs and Border Protection, has started issuing health questionnaires and is implementing fever screening at U.S. airports for all passengers on direct flights from Germany and Venezuela.
Thank you, Dr. Toner. So you've heard what the government is doing in response to this. What the president wants to know first is what should our priorities be? You've seen what we're doing. What are we missing? What should we elevate? What should we be focusing on as a government? Secretary of Defense.
It seems like we have a major problem, and I think we have to make a decision here. The president has to make a decision whether we need to publicly treat it that way. I would. And so we have to have secure, regularized lines of communication to the press and the public from the beginning. And I think they need to believe that we're telling them what we know and what we don't know, and that we're going to be consistent about it. I would banish from this table the idea that we're going to be able to keep anything secret anyway, or that we should treat the American people like children. I think we all need to start inventorying what assets we have available in our respective departments. To the extent we haven't already done it, I'm going to do that, including in the Guard, because we're going to need to know what is available, and I'm going to pay some special attention to logistics, supply, lift. I think we need to canvass what legal authorities the president has, and when we ought to invoke them. I'll defer to the Attorney General. And the only other thing from that I heard is, in terms of a priority to CDC, which is 1 year to produce a vaccine for this is too long. Okay. And I think the president ought to make clear whatever it takes to shorten that period of time, we need to do.
All right. Any comments?
Why don't I build on that? Let me first say what we've already done. As in past cases, we have set up a task force inside the State Department. We did that when the Ebola event occurred a number of years ago. We put in charge a senior ambassador with experience in this area. We are monitoring what's going on all around the world. I have two concerns. One, of course, is we don't want it to spread to the United States, which it hasn't yet. That's going to be the big concern. We can work with our international partners to take a number of steps. We have not taken those yet, other than issuing a travel advisory and staying in touch with our partners. But there are a number of actions that we could take, but I don't think we don't want to panic at this point. We're going to hear all the normal things about travel bans. But I think at this point we want to monitor and tell the American people that we're monitoring. And last point, we do have several Americans who are critically ill already. My responsibility is going to be to care for Americans outside the United States. And we are monitoring and prepared to help them as necessary. So I just want to tell you, we at the State Department, we are monitoring this very closely. We're in touch with our international partners, but I think we don't want to overreact until we learn more.
Great, thank you.
I have a question actually for the Secretary of State. What are we doing about Venezuela? I mean, you talk about international partners. What kind of partner are they?
Despite the tensions, Jamie, we do still talk to them on a number of issues, including on health issues. I don't think that we're getting all of the information about what's going on, but we continue to have diplomatic relations with the Venezuelans at a number of levels. We have our embassy there. I mean, this shows the importance of maintaining diplomatic relations with different countries. But it's a problem. We don't know that we're getting all of the information that we should. But the relations have not been cut off.
Secretary Vell?
Well, I think you've already heard a little bit about what's been happening within HHS, but we need to strengthen and extend those efforts. Clearly, alerting the American healthcare system and its providers to the nature of this problem, what to look for in terms of cases, enhancing surveillance so that we can identify as early as possible if there are problems. It's going to be very important to ensure we have appropriate respiratory isolation capacity should patients emerge, and we do have a network for routine care and emergency care, but we need to be working closely with that system. We need to really be canvassing to make sure that we know where our capacities are. I think we want to understand a bit more about this virus as well, this influenza virus, in terms of the nature of the organism. And now that we have a sample, NIH and CDC are going to be working hard to deepen our knowledge, including if it possibly could have been bioengineered. I think that is an important aspect that I'm sure the Secretary of Defense and Secretary of State will be engaged with us closely on, as well as colleagues in the intelligence community. I would like to know whether there's any evidence of animal engagement involvement with this particular outbreak, because we do know that there are animal variants, and I think there's a lot of concern that this could involve that. And I didn't hear anything about animal cases, but I think that's going to be very, very important. I'd like the CDC to weigh in, of course, but I would imagine we'd be wanting to send some teams, particularly to Venezuela, where the gaps in terms of healthcare capacity are extreme. And I think we have an opportunity to help them try to better contain spread, but that is time urgent. Germany is a more robust partner, but I think we'd still like to be working with them.
We actually
as well.
are having problems with that and big decisions to make on that. And if I could ask you to hold that thought for a few minutes, but very important point. We're going to get right back to that on Venezuela. Yeah, Secretary of Homeland Security.
I'd like to reinforce what the Defense Secretary said about being open with the American people. This is a virus we know very little about. We're going to learn a lot along the way. It is an RNA virus, which means it can mutate very quickly, and probably will, particularly if it starts to infect lots and lots of people. So we have to warn the public that we are going to learn as we go, so that they don't think we're idiots that keep changing our mind, because we are going to change our mind. We're going to find things out in the course of the next few weeks that we don't know. And if we do not have the public with us, we're in big trouble. I'd also like to suggest that we not make this a federal government-only effort. We have got to engage the private sector. They need to know what to do with their people. And also, some of our best technical capacity is in the private sector, not to mention the drug companies. But our best scientists, with no disrespect to NIH and CDC, are also in the private sector. And in addition to task force inside the government, we should engage some of these top scientists and drug makers in our deliberations as well, right from the beginning, so we know we have the best advice.
Other comments? Senator Daschle and the Attorney General.
Well, let me just build on Secretary Toole's comments. I think this is a time of need for extraordinary leadership. In the era of social media in particular, where truth is just an option, I think it's really critical that our leaders step up to the plate, separate fact from fiction, not be inclined to fall into the hysteria and the hyperbolic rhetoric that oftentimes comes with crises like this. We need calm, we need leadership, we need confidence, we need the ability to communicate with the recognition that there are unknowns out there, but we're going to work in a collaborative way to address those unknowns as quickly as we can. We should have stockpiled, we didn't, but we're going to have to look at that vaccine question to see if we can speed up the delivery of vaccine to something short of 12 months. I think it's really important, in addition to the private sector, that we recognize the critical role of local responders and first responders at the city and state level as well. There ought to be a coordinated effort to reach out, again, reflecting the need for leadership at all levels to ensure that we have a collaborative response.
Attorney General, then Congresswoman Brooks.
So let me build on those comments. I think it is absolutely right that we engage with the public, that we make sure that we are being truthful and transparent to the extent possible. But I think if we go out with a set of statements about the problem without having any agenda for the solution, our credibility will be shot. I think back to the Deepwater Horizon in the Gulf, where the president was viewed as observing a problem about to hit our shores without an action plan. So I would very quickly, if we could, Tom, come up with an agenda of action items, and that includes, in particular, addressing the resources and capabilities and inclinations in the states. Because, you know, they have, within the states, any number of powers that we have only with some level of complexity, including with respect to the National Guard. I think Secretary O'Toole's idea about full engagement with the private sector and the research community is very good, but I would come up with an action agenda. You know, this is not a legal question. This is a public policy observation from somebody who's been around for a long time.
And let's be careful not to overpromise. I mean, already the discussion about vaccines is making me a little bit nervous because there have been vaccines in development for many years. It doesn't look like any of those are going to be effective against this. So let's not get the American people thinking that if we just put more money and rolled up our sleeves, we could get them a vaccine tomorrow.
Do you think 12 months is overpromising?
I think we should be very careful. Okay. But I think we should say it's a high priority.
Congresswoman Brooks, you wanted to make a comment?
I really do believe that we need to continue to communicate, first and foremost, what the administration is doing and letting members of Congress, the House and the Senate, communicate and make sure that we know what the administration is doing all across the agencies so that we can communicate all that the administration is doing. I know that there will be incredible concern about the members of our military in Germany and the fact that we have men and women already at Ramstol and who are critically ill. I think the American people will want to know what we are doing specifically for the military. And to the extent that we can have communications tools about what the different steps that are being taken and letting everyone know this is the beginning, there is no vaccine, and do a better job educating the American people about how long it might take. But then we also have to remember for the first responders, make sure that they have the personal protective gear and that they are being educated on how to protect themselves. And so encouraging our leaders in Washington to go home and to be leaders in the community on this with their state and local health officials and first responders.
I'm all for working, I was going to say I'm all for working with states as comment on this, but I would do it from a position of strength. The President has the authority. If he invokes it with the emergency declarations, the Stafford Act, the Defense Production Act. And my concern is, I'd love to know what Senator Daschle thinks, because he knows, is that if these governors think we're asking them and they don't have to do it, once this thing starts to go, everybody's going to want to use their own resources in their own states.
When you say do it, what do you mean?
Well, if we need, for example, a lot of the medical units that you know, that I own, I really don't own because they're in the Guard. And so I'm just concerned is if we get a situation where we're asking these governors if it's okay, and this thing starts moving very fast, I think we need to go to them and say, look, we're going to do what we need to do. We want your cooperation. We're going to inform you. We need your help. In other words, this is not something we're imposing on you, but we're doing it from the standpoint of we've set up a chain of command. Your assets are at our command if we need them.
Director Gerber, you've been trying to get in.
Yeah, I think the agreement around the table is that communication is going to be critical, and I would recommend that we set up the Joint Information Center as a government so that we have a coordinating mechanism to keep us harmonized and all on one page. I think the other broad view around the table is that we need to lean in. And that's the hardest communication challenge there is, because you're asking people to prepare and do things, and yet the threat is not imminently here, although I think we need to assume it will soon be here if it's not already. So we're in this very challenging communication domain, and leadership really matters right now. Just to let you know a little bit more about what the CDC is doing, we have, of course, activated our Emergency Operations Center. We have begun the process of communicating with our stakeholders, so we've contacted the scientific media. We've been working behind the scenes with state and local health communicators, and the emergency risk communication systems and networks have been asked to lean in and prepare. We have some pre-stock messages. We're working on a case definition to go along with the diagnostics, because we've got to give people some reliable means for determining if they have a case or they don't have a case. But I think the real priorities in the short run are making sure that we are prepared with advice about personal protective equipment, that we are harmonized across the defense and the homeland security and public health dimensions in terms of force protection, healthcare worker protection, and citizen protection. If we let any air in between what we're recommending for soldiers versus health workers versus citizens, we're creating the opportunity for a very confused and a diminished credibility of our whole effort. Finally, on the point of countermeasures, I think we all understand the importance of not over-promising. I do think, however, that we have some parainfluenza vaccinology under our belts, and we need to get those people corralled and on the case of looking to see if there's any cross protection, if there's any value in what we have in the freezer, and then asking the pharmaceutical companies to go through their inventory of antivirals and make sure that we don't have any product that would have even some antiviral activity. And then finally, as we've seen with every single new pathogen outbreak that we've contended with, there's always the attempt to use serum from surviving patients as passive immunotherapy. And as you know, Dr. Fauci has recently brought that forward in the New England Journal as a potential option. So we need to at least get those scientists and that energy underway as a potential therapeutic, if not a prophylactic.
And just one add-on, I'm asking the FDA to work closely with CDC on the diagnostic, because we can't just have CDC as the only lab that can be doing that.
Absolutely.
We need to get it available in an emergency use authorization context so that we can have broad continuity of definition. And
Secretary Bellinger.
And I'm certain all of us are going to want to hear from the CIA director, because he may know some things that we don't. But just listening to all this, and I am the least expert, as you know, Tom, around the table in these disease issues, and it's good to see everybody, in fact, leaning in and getting ahead of things, because they've seen these before. On the other hand, your job is to advise the president, and I don't want panic being created amongst the American people. This may get worse, but you know, we're talking about military assets, we're talking about vaccines, we're talking about, you know, healthcare kits. We need to have the president say we are monitoring. Right now, this is in 2 countries around the world. There are some Americans who are sick. This could spread, but you know, we have seen when a president can create panic amongst the American people about external threats, and we get the American people overly exercised. So again, we're just not there yet. I would urge you to have the president instill a sense of calm to say we're monitoring this right now. Our departments are doing the things that are necessary.
I would not use the word, I mean, I would not make the basic message we're monitoring. If there's as great a danger in terms of public confidence if we are perceived as underestimating this, and then it becomes something that the average person thinks of as an epidemic that threatens their lives. So obviously we need a balance. I'm not talking about going out and, you know, waving it with our hair on fire. But I do think we need to let people know that this is, that CDC's issued this in the World Health Organization because this is a major threat to the public health. And we're taking action in addition to monitoring. And I would be careful about the messaging. I think they've got to see us leaning in. Plus which, and again, maybe I'm too sensitive to the Congress, but if the president is seen as not taking vigorous action, they're going to start firing from the Hill yesterday.
I agree with that.
Tom,
Director Smith, did you want to say something? Just to give you a chance.
Do. First of all, as this group knows, after 9/11, the intelligence community made a conscious effort to devote a lot more energy to collecting and analyzing the threat of bioattacks. We may not have spent enough, but we've certainly focused on it. And when this first broke out, I sent a note, a cable to all stations and bases saying, what do we know about this? And thus far, we have no indications that this is anything other than a natural outbreak. But in any public statements the government makes, I think we should say we have no current information that this is anything other than a natural outbreak. As this group has also heard me say, the definition of an intelligence officer is someone who goes into a room, smells the flowers, and looks for the coffin. So part of me is apprehensive about the possibility that this may be man-made, and we know that ISIS and Al-Qaeda worked on efforts to develop a bioweapon. They worked on anthrax, they tried to make sarin and so on, and we've seen attacks by other groups. So as we go forward, we on the intelligence community side will increase our efforts to work with our liaison partners. I want to make sure that we cooperate with all the groups that are set up here, but we need to, at the moment, keep our eyes open and see what else may arise.
Okay, if I could, thank you, Director Smith. If I could direct our attention to another issue that's come up that we need to deal with before we leave today, which is our decisions regarding travel policy and preventing the spread to the United States. And to put that in political context, I want to show you this clip that just came in this morning on the morning news.
Joining us now is Senator Gerald Watson.
Gene, I'm headed to the White House along with 5 of my colleagues, Democrats and Republicans, to demand a temporary but complete ban on all persons traveling from Germany and Venezuela. We can surely prevent CLADEX from crossing the Atlantic. We understand some cases may get through, but it would be foolish to let tens of thousands of airline passengers per week make that trip until we get this terrible outbreak under control.
Dr. Toner, tell us about this decision.
Yes, as we have discussed, all travelers from Germany and Venezuela are being screened for symptoms and told to report illnesses. But people with very mild disease may be missed by this screening. Furthermore, this does not protect us from people who are incubating the disease. As we've noted, Australia, China, Singapore, and perhaps other countries have shut down all travel from Germany and Venezuela. A poll issued last night found that 65% of the American public is in favor of suspending all travel from Germany and Venezuela. The U.S. has a $170 billion in annual trade with Germany. It is our largest partner in the EU. And 40,000 travelers per week come to the U.S. from Germany. So, furthermore, suspending travel from any country to the U.S. For reasons of an infectious disease would violate both WHO and WTO agreements.
So the decision on the table is whether we put into place any kind of travel ban between the U.S. and Germany or U.S. and Venezuela. And I understand that the President wants us to look at this very closely, given public opinion and given that at least a number of countries have begun to do this. We've already started that discussion with Secretary of State. Secretary Toole, do you want to make a comment?
Yes, we've had several experiences of diseases breaking out, and the first instinct is to close the border. We have proven beyond a reasonable doubt that this is a bad idea. It's almost certain that the disease is already circulating. We've had rumors of that in Tokyo and Taipei and so on, in London and so forth. During SARS, Singapore very rigorously screened people coming into their borders for fever, screened 3 million people, found no cases. Remember, they were a hotbed of SARS. So this is an opportunity to do something that is going to accomplish nothing other than diverting resources from real problems. It is very difficult to do. We have extraordinarily active borders, not to mention people coming in illegally. It puts our border protection personnel at greater risk. We are going to spend an awful lot of time trying to track people coming in. Remember what happened during Ebola, when entire health departments were diverted to tracking plane travelers, none of whom ended up having Ebola. We have to be very careful about this decision, because if we end commerce with the countries now named, we're soon going to be ending commerce with a whole lot of other countries, I would suspect, as we find more and more cases in different places, and it's going to become unmanageable. I would also suggest that one of the things that we ought to look into right away is the specific resources we know we are going to need. For example, personal protective gear, like masks, come almost exclusively from China. During Ebola, the hospitals went out, took the initiative, and bought so many masks and other related equipment that there was none left. And we caused a perturbation in the supply chain that didn't recover for 9 months. So we have to think carefully about what we really want to do, whether we have the resources to actually enforce these actions we determine, and whether they're really going to make a difference, or they're going to put us in this position of saying, well, we stopped Germany from sending travelers to us, but now we're going to renege on that idea of guarding the borders because we can't handle all of the different countries who are infected.
Okay, Director Gerberding and then Secretary of State.
Yes, thank you. I couldn't agree with the Secretary more. CDC has the quarantine authority, and we've looked into the science behind these kinds of interventions since SARS. You're absolutely right. This will accomplish nothing in terms of disease containment and will cause unnecessary disruption, particularly supply chain disruption, that will create a major bottleneck in terms of getting what we need. Our supply infrastructure is already at a critical capacity. But also keep in mind, Frankfurt, for example, is a major airport hub. Even if we prevented travel from Frankfurt, people travel from Frankfurt to every other country in the world, and we would have to then ban the second leg of their journey coming into the United States. So it is just simply not effective, impractical, and potentially harmful.
Secretary of State and then Secretary of Defense.
And I just want to strongly agree with both the Secretary and the Director on this. Again, you know, let's see what happens in a few weeks' time, but it's certainly premature now. The country has historically not put in place travel bans for health reasons like this. The Secretary does have authority the President has authority to ban a class of people if we be detrimental to the interests of the United States. But we are not there yet. There are other ways to address this. Our consular officials can interview people. Not everybody in Germany is sick at this point. There are people in parts of Germany who have not touched anything. We can address this, at least initially, and I defer to the experts here, through consular interviews and screening. And remember, just if we stop travel directly between Germany and Venezuela, people will just go through other countries. So we'll just encourage evasion. Last point, I again would want the Attorney General's views, but we can't stop Americans from coming back to the United States.
Secretary of Defense.
I agree with this, but I think we have to empower the President and the Press Secretary. So I think we're really going to have to give them the reasons why it's not in the interests of stopping this epidemic or this potential pandemic to do this. I wouldn't talk too much. Trade and that sort of thing are not going to be what they need to explain this to the American people. The other thing is, under what circumstances would we quarantine? Because if we don't do it now, but a week from now we decide we need to stop travel, then people are going to say, well, if you'd done it a week ago, all those reasons you gave why it's not good to stop, this doesn't work in stopping diseases, et cetera, and now a week from now we decide it's necessary.
So you're asking whether there are any conditions under which?
Yeah, I mean, because we got to be prepared to make that. Again, this goes back to what I said initially, that the confidence of the public in our honesty and our competence is going to be essential if this becomes something more than even Ebola was. If it doesn't, then it doesn't, at the end of the day, it'll kind of go away. If it does, though, we have to have that. So we have to anticipate what, what our communicators are going to be hit with. So is this something that we think we might have to do a week or 2 weeks from now?
So, Tom, I'm sorry to interrupt, but there's some intelligence that's just come in that is relevant to this discussion about the travel ban. First of all, we're picking up signals intelligence that some of our adversaries are backing calls for a travel ban in the hope that it will result in discord between ourselves and our NATO allies. Also, it will weaken our ability to conduct defense and intelligence activities overseas because we are churning people through so many overseas assignments. So our adversaries are favoring a travel ban for bad reasons. We're also picking up a lot of reports that from human sources that there may be future outbreaks in other countries, and it's much worse in Venezuela than initially reported.
Thank you.
Tom, I would just reiterate what I said earlier about how critical it is now, especially that we demonstrate meaningful leadership, and that leadership requires doing things that are oftentimes unpopular. I've got a number of my colleagues who have just voiced increasing opinion that we've got to take action, and this is the simplest and most direct way to address the problem, at least initially. They claim their constituents are calling with greater and greater numbers. They're on the talk shows. The social media is already out there clamoring for this action. So leadership is going to require, and I defer to my colleagues who know so much more about this than I do, if a travel ban is not the most appropriate policy, we need action to say what the alternative to a travel ban must be. Action or actions, but it has to be done simultaneously. You can't say we're not going to do this and then wait a few days to come up with something else. We have to be able to have an answer. If not the travel ban, what?
Secretary Hamburg?
Well, and that really was what I wanted to say, is that I think we do know that travel bans are not the answer, not now and not later, but we have to have a positive message about what we will be doing. We need to be very clear about the evidence, and we have to explain why travel bans are not the answer. But we also have to be talking about what we will be doing to quickly identify cases, to manage them appropriately. We need to be talking about the actions that are underway to support that effort. I don't know when we want to start talking about other kinds of activities that might need to be taken, such as reducing, social gatherings, whatever, and begin to, get people thinking about that as a possibility. I don't know, and that's something I'd really like input from others that have been directly engaged in how best to sort of stagger certain messages. But I think, number one, we need to probably be realistic that in this case, we're likely to have more cases in the U.S. than we did with Ebola because of where the disease is and the nature of the disease, and that...
Should that be part of our message now, that we expect there to be cases?
Well, I think probably yes, because it's, SARS, we were lucky. I mean, I still don't understand why we didn't have more cases in the U.S., but everything about this makes me believe that, it's a question of when, not if.
Congresswoman Brooks, you must be getting pressure from your constituents.
Absolutely. Our phones are ringing off the hook from morning until night, and then our voicemails are full when we get in the morning. And so, and we do have this large growing group of members that are calling for the travel ban. But I think that if the administration were to come before us to educate, again, continue to educate us about why a travel ban, why you're opposed to a travel ban, I think that would be very important, whether it's in a classified setting but bring all of the members of the House and Senate together to educate us as to what the game plan is going forward and why a travel ban is not the way forward. Then we could potentially, keep the pressure from the Speaker and from the leader in the Senate of bringing something like a travel ban to the floor. But I think that we have to have more education, and there has to be more information than, occasional briefings coming from the administration.
Yep. If I could jump in there, I agree with both of these. This is what I was trying to say earlier about the lessons of Deepwater Horizon, not a communicable disease, but one where the lesson was you have to go beyond monitoring to say, here's what we're going to do, particularly if you're saying no to something that sounds aggressive and protective. I just want to assure my colleagues here that we have, particularly since we changed the regulatory environment a year ago, all the authority in the world. So if we, for example, in our screening decide we need to detain people who we believe we have a reasonable belief will be communicable, could communicate this disease, we can do that. We can set up state facilities. We don't have to be supplicants to the Secretary of Defense's point. So I think that we should not be worried about legal authority. To be sure, there's some things that we could not do. But for the most part, any of the reasonable things that one would want to do, and certainly the reasonable things that one would want to have in one's pocket, we have.
Although, again, to be clear, unless we really stretch the Constitution, we could not tell Americans that they cannot come back home.
Yes, but I actually think, Mr. Secretary, that's not the top of the worry list.
That's not the top of the worry list, but there will be Americans coming back home.
There are constraints, absolutely. Now, in terms of, let's just say that the CDC sent workers to Venezuela or Germany, medical professionals, and they wanted to come back, we would still screen them.
I would actually like to, because it sounds like, fortunately, there is a consensus now for not having a travel ban, but we do need to explain what would work instead. And so I would actually be interested in spending a minute or two more from our experts on the sort of screening that can be done. I understand from our internal experts that our consular officials can delay issuance of visas until there is more screening. I have spoken to the German ambassador, who, of course, strongly opposes a travel ban, and have asked them to help us in Germany to do more screening. This is an advanced country. They have the resources to do it. I think they're prepared to work with us. But I would actually, to the extent, as the majority leader says, if we're not going to have a travel ban and sort of rush to judgment, what's the alternative? We need to be able to explain and have the president explain how this would work.
I agree with you. I want to hear that as well. But I also want to, since it seems like we have general agreement that that's the wrong decision, we should not have a travel ban in place, how do we explain to the president and to the American people why Australia and Singapore and China are all putting one in place? So our allies and our other major countries in the world are beginning to do something like this. So how do we explain the discrepancy?
Well, I think, as many have said, we have to say what we are going to do. In terms of that particular question, I think we say we are not going to engage in useless political activity. Instead, we are going to depend upon our scientific prowess and our capacity to innovate and try and get ahead of this thing. We need to do a couple of things. We need, and I'm sure CDC has already done this, tell people how they can protect themselves. We need to get to employers and encourage them to have people stay home if they have any of the early symptoms. We have a big problem here, and we're already talking a little delusionally, if that's a word, about our capacity to monitor. This is a relatively long incubation period. We have no diagnostic test. The screening we're talking about.
Diagnostic test right now.
We have a PCR
Yes,
diagnostic
it's not a
test.
rapid
You have
test.
no rapid point of contact diagnostic test. So it's, I presume, days before we get that result back. We need to create a rapid point of care diagnostic test that answers yes or no Do you think you have parainfluenza in an hour or two? We can do that now with the current technology. We do not have it on the market, but that ought to be the #1 scientific priority. Because until we can diagnose yes or no, we're going to have a whole lot of people with cough and fevers flooding into emergency rooms, and we're not going to know what to do with people coming off airplanes. So that's one thing. The second thing we need to do is we need to set up a line directly to all of the big employers in the country so that they have information that can fan out to their people all across the country, not just in the major media center. But we've got to get information out there on a real-time basis, and we have to tell people, and then we have to mobilize our scientific capacity to do whatever it needs to do. If CDC needs money, they ought to have it immediately, and I'm sure
the President's made
we
it
could
clear
arrange
that money
that.
is not an issue on any of these topics. So whatever we need, you're going to get.
If I could just, we have not yet given the President an explanation that's sufficient for why we're not going to do the travel ban. If our medical authorities say it is counterproductive, I will support not doing it. But if what we're going to do, with all due respect, is come in and say that these other countries are engaged in foolish political exercises, you're going to have some explaining to do. And because their medical authorities evidently think it helps them.
So what would be a strong
the
enough?
rest of it. So it's just, we have not given him enough. Look, I used to be in electoral politics before I got this position, and you're not helping the members either. They've got to, the ones who are going to support us have got to answer that question, okay? What is the CDC of Australia? They're crazy, or whatever the equivalent thing is. We've got to give them a better answer. Maybe we don't have to do it at this table right now, but
What's a
we need
strong
to send
enough
them on.
rationale? What would be strong enough?
I think it
for
has to be because it's in the interest of the health of the American people to permit it, and maybe that the effort it would take to say I was going to divert people away that we need for care. So it has to be done in terms of their health, not in terms of, oh well, it would screw up trade with Germany. I mean, I just don't.
It doesn't work in stopping disease, and we've got to get that message across clearly and definitively. It is hard when other countries have jumped in, but I think as Secretary O'Toole said, we had a real-world experience with SARS in Singapore, and it actually didn't work. And there are many other examples as well. So we have to be able to lay out the case and underscore the case that it doesn't work with it actually is counterproductive because it's hugely resource intensive, hugely disruptive. It actually will undermine ultimately our ability to respond. But then we need the counter case of what are the positive things that we're doing, which will include the ability to rapidly identify cases, to manage them medically and appropriately, and to put in place other broader public health measures as needed as we learn more about the nature of this organism, our public health tools to manage and control it, and also the issues around context for spread.
And I would like to ask the Secretary.
I think what we really need, more than anything, is efforts to build confidence. When there's this much disarray and concern and potential for hysteria, I think confidence building is critical, and that's going to require two things. First, a plan of action, and that plan of action has to be very clear and concise, and I would say a 5-point, 10-point, whatever it is, a plan of action. And then secondly, a communication and coordination authority to make sure that that plan of action can be implemented as quickly as possible. They've got to include Congress. It has to be executive and legislative together, along with the private sector and the governors and those who can help at the local level. But a coordination and communication authority is critical to help build that confidence.
Director Gerberding.
Yeah, I would two things. One is I would just like to ask the Secretary of Defense what the plan might be for the troops, because as I said earlier, we don't want daylight between what we're doing for our military personnel and what we're doing for our citizen travelers, et cetera. So it might be helpful if the Pentagon has thought through what we're going to do if this thing spreads among the...
What I'm told is, they're in isolation. They're treating the symptoms. I mean, I don't know. Obviously, they're strong. They're all in good shape. And we're hopeful that they're going to make it. And we're tracing everybody they've had contact with. So I'm told that we're following all the normal protocols. I completely agree that we need consistency in terms of how we're dealing with different first responder emergency, frontline personnel. And so we need to probably have, if we haven't already, interagency consultation about that, but I agree entirely.
The other point really was to remind people of what we did do during SARS, because I think we learned a lot of lessons from the United States perspective. We deployed EIS officers and a number of other public health personnel to the airports who handed out a yellow card to every returning passenger that defined the symptoms, the alert about the areas that were affected, the symptoms that would represent a concern, the incubation period, and what to do if they had a concern through the hotline and through other public health communication mechanisms. So while that is not the same thing as screening, it was a face-to-face reminder, and I think it served us well. We had a number of false alarms, which is what we desired. But at the end of the day, we did not end up in the US, as you know, with sustained transmission. So whether that had anything to do with it or not, it may be luck, as Secretary Hamburg suggests, but I think it was an action item that reassured people on re-entry that we were visibly doing something that was in the best interests of our travelers.
It's helpful.
Okay, I'm going to take those views to the President. Thank you very much for very clear judgments about that. We have a problem coming from a different direction, which is, what are we going to do about Venezuela? Secretary Hamburg already began to talk about this, Attorney General Gawrylik. So I want to show you a final clip from this morning on that situation.
Caracas is in chaos. On a good day, the government teeters on the brink of being a failed state, and the current outbreak of CLADEX could send it over the edge. Although government officials are still denying there is an outbreak, hospitals are overloaded, and reporters on the ground say many sick people cannot get the medical help they need. Cuban doctors have arrived, and several Russian military planes have been spotted at the airport carrying what appear to be medical personnel. Our sources say they have also seen Iranian and Chinese teams disembarking. How dire is this situation? Well, a few hours ago, I spoke with a senior physician from the Venezuelan Health Observatory, a research center at the Central University of Venezuela in Caracas. He asked to remain anonymous, but sent me this statement. He writes, "The government says nothing is happening. It is lying. The hospitals in Caracas are overflowing with incredibly sick patients. The hospitals don't have the isolation capabilities to handle those who are admitted, and many people are being turned away. The hospitals just don't have the capacity to handle them all. So families have to take the sick patients home, and this spreads the disease." He writes, "The only thing that will stop this epidemic is massive international intervention, like the response to the Ebola outbreak in West Africa. The U.S. is the richest country in the world, and it has the resources we need. Why won't you help?"
Dr. Toner.
WHO is requesting that the U.S. deploy medical teams to Venezuela. The Venezuelan president is publicly denying the outbreak, but privately, the government of Venezuela has indicated they are willing to accept U.S. medical assistance. Public health officials agree that Venezuela will need major outside help to stop this epidemic from spreading out of control. Cuba and Nicaragua have already sent medical personnel. The interagency has developed an option for consideration. The proposed plan is to send 6 civilian disaster medical assistance teams and 2 Department of Defense combat support hospitals, which total 750 medical personnel and 330 beds. This kind of deployment would be unprecedented for an infectious disease response. By comparison, we sent a small public health service contingent to West Africa to provide medical care for Ebola patients. DoD did provide logistics support and constructed medical facilities, but did not provide medical care.
So the decision for us is whether to recommend pursuing the option on the screen. Should we deploy a substantial DoD and civilian medical support effort to Venezuela at the start of this outbreak to try and get this under control? Secretary Bellinger.
So I would support this request. One of the things that clearly we do have to do if this crisis is going to be spinning out of control, which again, it's too early to tell, but it looks like it is heading in that direction, is we are going to have to lead internationally. And we've got the connections with countries all around the world, both with friends and with adversaries. So we are going to have to lead. Venezuela is not North Korea. That would be a more difficult situation. We have tense relations with Venezuela, but unless my staff tells me otherwise, Venezuela is prepared to accept our support. So I would strongly recommend that we do that. In addition, we need to work through other countries who have got similar concerns. If the Russians and the Cubans have already been invited in, we need to work with them and with other countries who have relations with Venezuela. We may have other political and economic issues with the Venezuelans, but as far as protecting the American people, I think this is something that everybody ought to be able to understand.
Okay. Dr. Smith.
A note on intelligence. I said a moment ago that there's some initial reporting that this is going to spread, so beyond Venezuela and Germany. So the question I have really for the Secretary of Defense is, if we deploy these forces to Venezuela, what do we have in reserve should there be outbreaks elsewhere in the world? And secondly, if we do have people go in there, the situation on the ground is a mess. And do we have adequate security to protect the Americans that we do send to the ground in Venezuela?
I was going to bring that up because I feel like in addition to the medical care teams that are going, we need to augment the public health investment there. I don't know where PAHO is in this effort, but I think from a CDC perspective, we want boots on the ground from a public health perspective as well to really understand the transmission dynamics in more detail, the infectivity. There are a number of aspects of this that we still don't have complete information on. And because we still don't know the proximate source of this, I think we need to dig deeper, maybe in conjunction with the CIA and other intelligence agencies, to understand where did this really start, what's ground zero, and what's really going on.
Would CDC need DOD support to go into a place like Venezuela, or CDC be able to put its people in with or without?
I think we would want security and logistics support, so we would want to be considered part of the team that is responding from the U.S. perspective. But again, we wouldn't be providing medical treatment per se. We would be working with the relevant public health entities in the surround sound and understanding the epidemic.
So would you be, just to finish, would you be in support of the medical side as well as the CDC side at this point?
Absolutely.
Okay, Congresswoman Brooks and then Secretary Hamburg.
Well, I think from talking with my colleagues, we would have grave concerns about sending teams to Venezuela at this point. This is a government that we have little to no relationship with, and there's no real understanding how long those first responders, those teams would be there, and how, when they would be reintroduced back into our country, will they be bringing the disease like the doctor brought the disease from West Africa? Are we really going to be putting our medical personnel in harm's way, and are we really going to be allowing 750 Americans to go in to a place that we have little to no medical support, little to no medical system set up? There's just such a lack of confidence. I think we would be much more interested in making sure that we focused on Germany and trying to contain it in Germany. I think we also would like to really continue to understand why the other countries, if China is already agreed to send and they've let these other countries go in and contain it, whether it's China and Russia, let them go in and contain it. In Venezuela, let us focus on Germany.
Tom, there are a number of senators who have expressed real concern about the lack of coordination with the Pan-American communities. Pan-American Health Organization and WHO, of course, has the International Health Regulation, which requires that notification of an outbreak of international concern be made, that we strengthen national capacities to prevent, detect, and respond, and collaborate with each other. And none of that appears to be going on right now. So I think there's a lot of interest on the part of members of Congress to address the requirements of the law already. The other thing I would mention is that we know so little about what's going on in Venezuela right now. I wonder how it is we've ascertained that this specific response is the appropriate one. Would it make sense to send a team of of people who could provide a better sense of what's happening before we commit with any precise measure how we respond.
Yeah.
Secretary Hamburg, I think you were.
Well, I just want to say, clearly I'm not an expert on geopolitics, but in terms of infection control, I think it is clear that Venezuela is now becoming an incubator of disease, that our best bet to be able to control global spread, including to the U.S., is to get as close to the source and contain it as quickly as possible. And so I think Venezuela is absolutely critical to our national interests as well as to global interests in disease control. I think we do want to coordinate with other countries. There's no reason that we have to come in and do it all, but I think we want to have a very clear picture of what is going to be the capacity on the ground, what can and will be done, because this is time urgent. I do want to say that we are prepared. I just got an update from our HHS group working on this to deploy the U.S. DMAT teams and public health service members to Venezuela. And I certainly support what the director of the CDC was saying about the need to strengthen public health capacity as well. But it is important to realize that the DMAT teams are not equipped or trained to respond to infectious diseases per se, and that there are a limited number of people involved there to provide care. And security and logistics are going to be very important. We need to be able to guarantee medical evacuation for those who are sick, and we need on the ground to be able to assure protection of our first responders. And that would include some things that aren't on the list there, including we need to have personal protective equipment, and we need to have clear guidelines on what works and how to use that personal protective equipment. We also do need to accelerate the point of care diagnostic that the Secretary of Homeland Security talked about, and the FDA and CDC are going to work closely on that. But I do feel very, very strongly that we may not like the political environment in Venezuela, but it is actually vital to our national security that we work in Venezuela and with the Venezuelans, and it's a particularly vulnerable situation because they are so close to being a failed state and their healthcare capacity is so deficient.
Can I jump in on that point? It's not just a failed state as far as healthcare. They may be a failed state overall. So this is in our national security interest for two reasons. One, listening to our doctors and public health experts, this is one of the locations. So we should not just leave it to them. We need to go and try to cut this off there so that it doesn't come to us as a health reason. But second, this is close to a failed state already. This could tip them over the edge. The government will fail, and then we really will have chaos. And if the president is concerned about refugees coming up north, this would contribute to that. This just in, I do get the point about the security of our healthcare workers. I don't think it's as serious a issue as people think. This is, again, not going into to North Korea, but we have raised this issue with the—
You mean physical security?
Physical security, as far as whether the Venezuelans would arrest them and put them in jail. We have broached the subject of having the military accompany them. Not surprisingly, the Venezuelans have said absolutely not. We are working out the diplomatic terms. We could assign these people to the embassy, give them the normal privileges and immunities. We do have diplomatic relations. I think this can be worked out diplomatically, but we are not going to be able to send military protection along with them. But other than that, I agree completely with the Secretary.
If we do resolve these issues, would you be willing to send military?
Were you just saying that none of my people have to go? Because then I'm fine with it. Look, these are assets, and I don't have a whole lot of these assets. A lot of my medical assets are in the Guard anyway, and which means we got to activate them to be able to get them. The way this thing is developing, we're going to need this in places where we know they can do some good. What you're saying is let's send DOD personnel into an extremely unstable country in the middle of a developing pandemic where they're probably going to get sick, and we're a government that is basically hostile to what they're doing, and we should recommend this to the president. I understand where you're coming from. I know that from a classic, probably health policy, you go right to what you've identified as the center of the of the epidemic and learn as much as you can about it. This is not, as far as I'm concerned, this is a non-starter. I'm going to need these people. I got this feeling in a whole lot of other places. I'm also going to say this. I think we need to recommend the president, and a priority in decision-making needs to be to keep our own first responders and our own frontline personnel as healthy as we possibly can. Because if we start losing them and they get sick, we're going to be slipping down into a deeper and deeper hole. So no, I don't see this as the answer, and no, I would not. And if were you saying the Venezuelans won't let us in anyway to provide security?
They've said, to the point that I think was raised of would we need to send people to protect our people from arrest or incarceration because of the tensions with Venezuela, they would not accept physical violence. They would not accept armed military people, but as I understand it, they would accept our military health experts.
Well, yeah, that's why I wanted to jump in here. I mean, as the Secretary of Defense knows, I was recently his general counsel, and I would not recommend sending military health workers without protection. We don't do that. And that's very nice of Venezuela to say that, honestly, and I respect the views of the Secretary of Health and Human Services that you go to the source, but honestly, for them to say, well, we'll take Dr. A and Dr. B, but not the people on whom Dr. A and Dr. B rely for their safety and security, I just don't think that's a tenable solution. I think, frankly, Mr. Secretary of State, you've got your work cut out for you.
Director Smith, sorry, Secretary Toole, and then Director Smith.
Yes, I have some information here that I think supports the Secretary of Defense's position and yours. I've just heard from the U.S. Coast Guard that they've intercepted at least 5 boats carrying people from Venezuela who are headed towards Puerto Rico. And they're seeking refugee status on the basis of the epidemic. The Coast Guard also reports that they see many more boats coming our way, and they're requesting additional resources to intercept these boats, as well as guidance about what to do with these travelers. I would like to suggest that there's very little, realistically, we can do for people with DMAT teams medically. We do not have any treatments for these viruses, and we're not going to stand up a whole new healthcare system for Venezuela, even with a significant portion of our DMATs. I do think we have to support PAHO, and I would like to see PAHO being the belly button for U.S. aid in South America. This is not going to stay confined to Venezuela. We're already seeing what's happening here. And that we do everything that we can from a public health point of view, including offering CDC advisory resources, but not send our health care personnel overseas just yet. I think it's a drop in the bucket, and this is a public health emergency. Medically, we don't have many tools at our disposal. As far as the Coast Guard goes, I think we have to talk about what we're going to do with these folks, some of whom may be quite ill.
Just to play devil's advocate, it is true that DMAT teams certainly have not responded internationally to this kind of thing, but with the DOD side of things, the DOD medical personnel, I think
the DOD medical personnel are often reservists who are serving in their local communities, and we may need them.
Okay.
It's not perfect, but, you know, I guess I would repeat what I said before. We need to coordinate with other entities, and great for PAHO to take the lead. But I think, you know, that there is value in trying to help Venezuela develop some management capability within the country, and I think that is essential. And
management capability, yes, but on the ground medical care, I think, you know, we don't have enough to offer that would make much difference. Public health advisory, absolutely. And then we have to organize the rest of the world to join in. We can't handle this on our own.
I think that's right, but I think we need to figure out what can be done within Venezuela, because otherwise...
Well, what about Brazil? They have considerable medical resources. Can we get them to take the lead in South America?
Well, this is something that we have been working on. I mean, I'm taking the recommendation of the interagency that we have the expertise to send. I defer to others on the effectiveness of that, but certainly the one thing we really can do and are good at the State Department is working with our partners around the world. People are not always responsive, and sadly, when we beat up on them on a regular basis on other things, they are not often as willing to help us in our time of need. That's one reason it's important to have good diplomatic relations with other countries. But we can do this. Brazil, there are lots of countries in the world that fortunately have better relations with Venezuela than we do, and they've got good medical care. The one thing I think we shouldn't do is just leave Venezuela to rot, because it will, one, become a worse public health crisis for us, and as I said earlier, potentially result in the collapse of the government and hundreds of thousands of refugees.
And all those cases will trickle out.
We will, for you in the health area, if you will let us know which countries you think have got the best health capabilities, I will be on the phone with their foreign ministers to ask for their help.
Director Smith?
I have two intelligence reports to pass on. One is amplification of what Dr. O'Toole said about the number of boats that are coming. We're picking up lots of signs of that. Many, many more boats coming out of Venezuela. Secondly, disturbingly, the Russians are clearly trying to take advantage of the situation in Venezuela and are using this as a screen to establish a much larger presence in Venezuela, way beyond just the immediate health concerns. So it presents a particular challenge to the United States as to how we respond given all of these considerations.
So would it be in your judgment that on a geopolitical level we should be doing more in this situation?
The intelligence business is not about providing policy advice. However, we can say that the impact of not doing something has lots of consequences, not just in terms of healthcare in Venezuela, but also in terms of our geopolitical position.
But may I follow up on that, please, Mr. Director? I'm mindful of your initial comment and observation that the Russians were, and some of our adversaries were trying to foment a problem here. And I wonder whether drawing us into Venezuela is part of that. I mean, I think we need a view. And I appreciate that you're not in the policymaking mode, but I think we need a view from you and your agency as to whether this is part of an action on the part of our adversaries to weaken us, divide us, and distract us by engagements that will disable us at home.
The answer to that is yes. We're getting a lot of indications that, as I said earlier, our adversaries are trying to take advantage of this. They're trying to champion a travel ban knowing that it's hard for us to do, that it presents lots of complications. The same thing is true of the Russians. They're very close to the Venezuelans to begin with. They're now trying to take advantage of this to get a presence in Venezuela as they had in Cuba for many years. So this presents very real challenges.
Congresswoman Brooks?
I'd like to just ask Secretary of Homeland Security whether or not our Coast Guard is prepared with sufficient protective gear on, their ships and boats to deal with all of these people who are now traveling between Venezuela and Puerto Rico. And with what Puerto Rico has sustained in this last year, how are we prepared in Puerto Rico to deal with the people that are going there, whether or not Coast Guard is able to pick off and pick up all of these people in the boats, or what are we going to do with them? So I'm very concerned. And then secondly, I can just share with you that I do not believe the American people will support sending 750 medical personnel without military backup. I just do not think that, and while I completely appreciate we must go to, but I think we ought to really engage any allies, whether it's Brazil through the State Department, to really engage with Venezuela. But I'm more concerned right now about our Coast Guard, who are the first responders right now with potentially infected people.
Okay, we have a few more comments and then we're going to have to close this. Secretary
I think
Townsend,
we should
Hamburg.
recommend to the President, I don't know if it reflects the unanimous opinion, but I think we should recommend the President that we not invest substantial amounts of American personnel or assets in Venezuela that we're going to need in other places. The downside of it is enormous, and the upside of it is highly speculative. It's going to be pretty hard to explain why we're not doing more to protect from flights coming in other countries because we want to save resources, so we don't want to divert to that, but we're going to put the resources into Venezuela, especially given that we could very well be walking into a Russian trap if we did something like that. And I need to say, because there may be other places where we do like Germany, to send in our medical personnel, and where DOD personnel are going to protect them, and they're not going in without their weapons. I don't care what the local government says. We don't send my guys in without the capacity to defend themselves. So I think we ought to get this off the table.
Okay, does it not sound like we have agreement in the group, and that's okay? We want to hear all minority views or majority views. But Secretary Hamburg, did you want to say something about that or other?
Well, I just wanted to underscore, we're not going to do a travel ban not because it diverts resources, but because it doesn't work. It's not the effective strategy. I think we do have to be realistic that we're going to need resources here in the U.S. to manage cases as they come. We also have to recognize all the complexities of going into Venezuela. I'm not sure that we should just follow this interagency option and give it the rubber stamp now. I would say we need to immediately convene a group to look at what are the potential strategies with Venezuela, including our other potential partners in terms of a response there. Not decide now what we are going to commit. And I agree that this is probably not quite the right formula for many reasons, including both numbers and meaningful capacity for management and response. But I think we really do need to have a targeted, time-urgent focus on the situation in Venezuela to try to contain it as best we can.
Senator Daschle.
Tom, I've agreed with Secretary of Defense on virtually everything he's commented on so far, but I have to take issue with what he has just said. I think this is a catastrophe waiting to happen. There's an old expression, if you don't visit a bad neighborhood, it will visit you. And Venezuela is near our shores. It is chaos down there. If we don't have an urgent response to begin to contain it, working with our other allies in the region, if we don't put as much attention to that Venezuelan crisis today, tomorrow, the next day, it will be here. And we can't afford that. So we've got to stop it to the extent we possibly can before it gets here. And the only way to do that is to commit resources. There is no risk-free strategy in anything we do. We're going to have to realize that we're going to have to take some risk, but we've got to do all we can to contain it before it comes here.
I'll just say I agree with that, but if the military is not going to travel without their weapons, which I understand, and the Venezuelans will not accept them without their weapons, and in fact, I think I hear even that as a medical matter, you're not necessarily recommending this, and I think we have to make as a higher priority working with other countries. Now, the other countries are, including the Russians, whether they are fomenting some of this or not, have also got to be worried about this crisis. We have an interconnected global system. There are a lot of countries in the world, including Russia, who have got to be concerned about this crisis in both Germany and in Venezuela. So we will push them harder. All the countries in the world that we think could actually help here, and we will torque up the pressure on them. Again, that's what American leadership is about. If we can't do it ourselves, then we will have to push others to help.
I'd like to respond to Representative Brooks's question.
Thank you.
We have sufficient resources in the Coast Guard now. We may be asking for assistance from the Southern Command if the flow becomes greater. We also have a cache of personal protective gear that we have issued to the Coast Guard, so they have masks, which might be some protection. But our people are asking, what about my families? It's one thing for a member of the military to put his or her life on the line, but to bring it home to the wife and husband and kids is another issue. And I would say, again, we really need a rapid diagnostic as a first priority so that we can identify the people who truly are infectious. And I would also like to ask Director Smith, do we know if this is an engineered organism yet?
If it's an engineered event, we do not yet have any reporting on that, but as I said earlier, We are trying to find out. It is possible, given the advances in genetic engineering, and we know that groups who wish to do us great harm are working on these sorts of things, but we don't have any reporting yet.
Do we know if Russia worked on this particular organism in the past?
I beg your pardon, if what?
Do we know if Russia worked on this particular organism in the past?
I have no information on that, but I will ask my staff.
Okay, we're going to have to leave it there. Thank you all so much for those comments. The President really values your input on all of this. Before we leave, we need to show you one final breaking story that happened while we were meeting.
New information is coming in about the CLADEX virus. Let's go right to our medical reporter, Emily Schmidt, for details. Emily?
Gene, anonymous U.S. government sources have told GNN that the genetic sequences of CLADEX from the initial Frankfurt case reveal the virus has some genetic elements of the Nipah virus mixed in with the para-influenza genes. Nipah is a rare tropical disease. It's related to para-influenza, but it has a high lethality in humans. Human outbreaks of Nipah are uncommon. The largest outbreaks have happened in Bangladesh between 2001 and 2003, with a 70% death rate. Some experts have speculated on social media that this new virus may not have occurred naturally. They suspect the virus escaped from a laboratory researching a vaccine for Nipah. Others say it is probably occurring naturally, and there may have been some exchange of genetic elements between the viruses. CDC and WHO cannot confirm these reports and say they have no evidence of a laboratory mishap or that the virus is a biological weapon.
Okay, we're going to need to get much more information on that, and we will get that to you as soon as we have it. But this meeting is now adjourned, and we will call upon you again shortly for more valuable help. Thank you.
Thank you. We will now take a short break, but please be back in your seats at 10:55. The next session will start at 11 a.m. Thank you.